Discussion of House Bill Number 211 and potential unfunded mandates.
As I get started, I would like to call up some of the partners, and we're going to engage the administration as well. If Elsie could come forward, Kim. I know we have a couple of additional special guests. Judge Garrett is here, as well as Brad Foreman. Councilman Rubin isn't with us, but wanted to bring this issue forward with the session recently ended. This bill, which was initiated by Governor Jeff Landry, was supported by the majority of our local delegation, but it comes with concerns. I know members have often talked about unfunded mandates and things that are being asked of us to do locally from the state level, but the resource doesn't accompany it at the local level. Obviously, we have had some significant local media coverage and discussions and social media activity as it comes to what I opinion as the most challenging issue facing governments today, and that's being able to serve our homeless population. And it's so complicated, and I think people try to simplify it. And when we start talking about what happens at bus shelters and on public rights of ways and spaces, it is a simple observation. But when you start looking at substance abuse and mental health and family abandonment and a limited supply of housing inventory, it becomes very complicated. And I just don't think it would do the entirety of the Lafayette community to try to look at this simply when we should be looking at it very sophisticatedly. So I don't think we was able to get any legislators to attend due to, I guess, schedules and other things, those individuals who actually passed these bills. And I'm hoping at some point we will be able to hear from them and they could share what their vision of this is. But locally, I think we need a plan. I've been looking for this moment for quite some time because, again, of the talk, and what we don't need is to create pickups and dumps, and we don't need to move forward without a plan, without being able to properly address the issue, and we don't need to mislead the public that we will be able to do something that from a resource perspective we're really not ready to do. So with that said, for those who are here, thank you so much. I don't know who would like to begin. We always could lean to the judge. Whenever the judge comes, we certainly want to honor. And Judge Garrett, again, thank you for being here. So I certainly welcome anything that you have to share this time for this group, as we're going to have to come up with some way to deal with this issue.
So when the bill came up, Kim called me frantically. And because it was going to pass, the only solution I have, when I read the bill, it makes a misdemeanor a first offense. The language, there's some very specific language in here. It talks about substance abuse, co-occurring mental health court, and presently I have 340 people in drug court. Today I got my first coin because we got completed veterans court, to have a veterans court that Jules started 10 years ago. What you have to realize, the people that you are seeing that are homeless have the mental health, they're vets, they have substance abuse disorders. They feel better on the streets, some of them, because of the PTSD. So the 340 people that's in my drug court presently are probably your homeless population. Because we have now built layers upon what he started, we are able, thankfully to the mayor and all of you, because we have the opioid money and because we have a partnership with DOC called Recovery Housing, which our court is going to present nationally at All Rise. DOC allows us to give people who come out of the prison system housing for 6 months. The problem is with your homeless population, if they haven't committed a crime, you can't get them into treatment. Now, the AOT court, which is legislatively established, which I tried to start, you got to be able to get them and make them move through the system. What the governor's doing here is forcing them into the criminal justice system. And once you force them into the criminal justice system, it talks about a homeless court, but we already have a drug court with a co-occurring mental health court. So instead of establishing a separate court, we already have resources that we receive from Supreme Court, for people who have substance abuse disorders. But that money is earmarked and we have to use it very carefully. But for the opioid money we have, we would not be able to provide housing. So hypothetically, we have somebody come to the jail. They're in the jail, they're homeless. Most often than not, 95 of my persons are homeless. They come to the jail, we do an assessment, we get the jail to drug test them when they come in. Then my team goes in and does an assessment to see if they're high risk, high need. Once that assessment happens, then I can move them to a treatment facility. When I move them from a treatment facility or to Genesis for co-occurring mental health, then I can, when they come back to the jail, we have worked out with the jail that whatever pharmaceutical medicine they need, the jail will comply and meet those needs. The problem is, if you take that person and put them back into the jail after you've treated them, you're wasting government money. So then we had to figure out how to house them. I put a watch on them, I can track them, I can put a geofence around them, I can know where they are. I work 24/7. My team is on call on Saturdays and Sundays. In the evenings, if I get an email right now, I know where my person is. And if they're not complying, I issue a rescission order and pick them up. So we already have a drug court. And when I read the bill talks about substance abuse co-occurring. The bill doesn't provide for housing. But we are not in the situation of most people in the state of Louisiana. We have just recently learned how our court is at the forefront of doing something different than the rest of the state of Louisiana is doing. Now, but for the money we received from the opioid grant, those people would be homeless, they were living in TL, there would be no housing. We house people and give them grant money for a month or 2 months so they can get on their feet, and they're working. They're mandated to work. So when I read this, it's misdemeanor first offense. When it's a misdemeanor first offense, we built into the program, which is going to coincide with what Senator Boudreaux did with Judge Edwards' bill, right? Because now you have alcoholism, you have vets, we have vet services, we have a veteran program that's integrated now into drug court. So the only thing I can tell you at this point, we as Lafayette Parish, we're not hopeless with this. It's not going to start till January, but we might need a little bit more money, Mayor, to help fund what we're doing. But all of your homeless people, we pretty much know them. But there was nothing to force them into the system. They can go to treatment, check themselves out. They can go to treatment voluntarily, but when they go to treatment with a court order, they're mandated to stay. If they leave, then they're rearrested. So there's nothing right now, I guess, unfortunately, without the arrest, to help me navigate them through.
Stand in front of the mic, Judge, so they could record it if you don't mind.
Sorry, I should know better.
Yeah.
I should know better. But there's nothing in place, and it's unfortunate because if the jail's already overpopulated, if you give them a misdemeanor summons and let them go, you take all of their things that is treasures to them, right? You take everything from them, you give them a misdemeanor summons, and if somebody doesn't intervene, they're back on the street. They get rearrested again, and it becomes a felony, and then they're serving time. So the jail has worked really well with us, and the only thing I talked to Kim about, that if, instead of creating a whole new court, because of the language that's in the bill, we already have that court established as the drug court, right? So we can offer those people, even misdemeanor, even the city court folks, we already have a track that's 18 months that we hone in on misdemeanors, which was what Jules tried to start in order to catch them early. If you don't have the weight of the bench with some of the homeless people, and some of them, you may not be able to help them because they may be too far gone, but the PTS veterans we have presently, there's places we can send them, and we have a veterans coordinator, and we can get them resources. The jail can identify them. We can get them disabilities. We get them Social Security cards. We get driver's license. We fully service the people that we have in drug court. And that's who is your homeless population.
Thank you so much. My name is Elsa Dimitriadis. I'm the Executive Director of the Acadiana Regional Coalition on Homelessness and Housing, which is the lead agency for our 8-parish continuum of care. I appreciate and am grateful that of your understanding of the nuance behind this bill and all that it entails. I can't speak to legislative intent, but I can speak to some local implementation realities. So just to level set the conversation, according to 2025, we had 205 people who were unhoused, and 205 people who were unhoused but living in emergency shelter, so a total of 410, with around 90% from Acadiana. So to dispel that perception that people are coming to Acadiana to experience homelessness or to access our resources. Our shelter beds are at 96 to 98% capacity each night. When someone refuses shelter, because that's a question that we get asked, we continue to engage through outreach. That is not the end of the housing solution. We are still engaging with them. We're working on a housing plan, et cetera, even if they choose to remain at what we call street-level homelessness. What happens when someone is arrested under this law? I appreciate what the judge offered. It does make our work more complex. We often lose track of folks. And I'm not talking about those who go through that court program, but if they were just arrested, we lose track of them during that process. We lose track of them after they're able to leave. And if they stay incarcerated for longer than 90 days, they're no longer considered homeless by HUD's definition, which makes it difficult for them to access resources. So I say all this to just illustrate that it is a very complex space. If asked, will this reduce homelessness? I think it depends on what outcome we're trying to measure, right? If we're trying to reduce visible encampments or reduce homelessness, that's not necessarily the same outcome as long-term reductions in homelessness, right? And so, that generally requires exits to housing, treatment, income, family reunification, and other stabilization pathways. So again, I'm excited about the opportunity to have these difficult and lengthy and nuanced conversations, and I look forward to the next opportunity to do so.
The other thing I need to add, because you mentioned that, is that every person that comes to our court, we are able to apply for Medicaid immediately. So in order to get some of these folks services, Medicaid is necessary. And everybody that comes to my court, my treatment liaison is there with her laptop applying for Medicaid so they can get the resources immediately. Drug court has limited resources from Supreme Court, but the combined efforts of the Medicaid, we can get them moved to Genesis, we can get them moved to treatment, and then they can get their drug screens done through those programs. What I'm most proud of is what you talk about is that our court now treats the total person. I don't lose them. And when I lose them, I look for them. But when they don't have our resources, you're absolutely right. It's a revolving door. And then what you don't want is a misdemeanor person to come into the jail, and then it's overpopulated, they stay too long. When misdemeanors come in and the jail recognizes a substance abuse issue, I get an immediate phone call and we start moving them. And so relationships are important and conversations are important and being proactive is important. Otherwise, that homeless situation, if you don't get that person to trust you and to build in some services for them, there are lots of people you have to understand will prefer to live on the streets than to live with other people because some of them are shell-shocked. And so they're used of it as military people or used of it from trauma. So you have to build in time in relationships in order to make them safe. The jail won't even release somebody that belongs to us in the middle of the night. They'll keep them until I can get housing for them and I'll move them in the daytime. Because if you release them in the middle of the night, they're going to commit another offense if it's cold. So it's very complicated. But we have come over some hurdles in the last 6 years to be able to do better for our Acadiana residents.
Kim, between you and Elsie, y'all kind of the lead as it relates to this issue. I guess, has there been any talk of a plan? Because I just find that it's just been, moving through it one day at a time. When do Lafayette in particular, when is there a plan to address our issues? Because like Elsa said, we talking about the removal of encampments, that's one thing. And that was a concern because the question is, okay, where do we move them to? Mm-hmm. And, you don't want to push everything into one area. What is the plan?
Right. So Kim Boudreau, Catholic Charities of Acadiana, and I just want to acknowledge the incredible work that Judge Garrett does on a daily basis and what a treasure and an asset she is to our community in the work that she's doing. And she does look for people. I've seen her look for people, and I think that no one wants to get Judge Garrett to call you on a bad day. So thank you for the work that you do and the line that you hold. And I do appreciate the work that Elsa is doing as our continuum of care. In addressing and I think that I respect the challenges that you face because you represent the district in which we operate in, where every day we are caring for the basic needs of right under 200 people a day, life-sustaining services such as food, medical care, showers, laundry, shelter. And so it is a significant concentration of people in crisis in one city block, and that does have a direct impact on our neighborhood. So when we see legislation come forward like this, I have concerns about we already don't have the resources that we need to respond to those that are seeking our services on a daily basis. And we did a look back, and we are turning away roughly 80 people per month that are asking for unduplicated, 80 unduplicated people per month that are asking for shelter that we don't have room for. And so that puts us in a situation where we have a high number of people that are sleeping outside that would, if given the option, would come inside. And so I think that our city needs, and I think that this is a great opportunity in the next 6 months as we look to the January 1st implementation of enforcement to get serious about what is needed in the homeless response infrastructure, where are the gaps that need investment. And I think that most of us would agree that there is a need for more shelter, emergency and transitional shelter in Lafayette Parish. There's a need for resources around diversion where we ask everybody, where are you from? And if they're not from Lafayette, we want to send them back to the community that they came from, but we don't want to put them on a bus randomly. We want to connect them back with family. And so we spend funds that on returning people to their communities of origin, because it's far cheaper to return them to family than to continually try to stabilize them in a community that they're not from. And of course, housing is deeply affordable housing and supportive housing, where we do have long-term options for people that have gone, for those that do need recovery services, have gone through that process of recovery and need an affordable place to stay. Some people need support, some people don't. It's a complicated, nuanced thing, just like the rest of us. And I also want to touch on, which is part of why I have Brad here, and I've invited and encouraged Brad to be part of this conversation. We are part of why we don't have room in our shelters because we have seen an increase in highly complex, medically vulnerable individuals that have entered into homelessness that have high medical needs. We have several that are in hospice care. Some have mental health conditions, some have substance use disorders. But these are highly vulnerable individuals with complex medical disorders and diagnoses that probably never should be in a shelter because we're not licensed to provide personal care like bathing and feeding and diapering, administering medicine. That's not what a homeless shelter really is supposed to do. We're not a medical facility. We don't have nurses or CNAs with us. But time and time again, we find ourselves in a situation where there is no place for this person to go, and there's no place for this person to die. And so we're a Catholic organization founded in gospel values, and we feel compelled to offer a dignified place for a person to die if they have no family and no place to go. And so it's an issue that we've been grappling with, and the need for expanded services, but how do we do that in a way that isn't detrimental to our neighborhood? And I think that you get those calls every day. It's in concern of ours as we exist today. And I think that I've become a joke at City Hall now. They say if you call Kim, she's going to ask you for money. But in reality, we spend $3 million a year in our homeless service portfolio. LCG is a great partner with us, and not just funding programs, but also a thought leader in bringing together partners that we have a great pilot program with 12 Together, some of the most complex homeless individuals in Lafayette Parish right now, where it's cross-system work, bringing together law enforcement, the hospitals, medical providers, homeless providers to kind of triage a plan for the highly vulnerable individuals in our community. But the funding that we receive from LCG represents 7% of the funding that we spend on homeless services. And so there is a need for funding to support what we're doing because there's not enough to cover what we're doing. I'm excited about continuing to partner with Judge Garrett. I would suggest that instead of adding a new court, that we add maybe homeless court on top of what you're already doing.
And that's kind of what I'm suggesting at this point. And the thing is, what you're doing is great work, but what we fail to realize, it's going to go away because it's going to be a mandated charge. Mm-hmm. It's going to be a criminal consequence to being homeless. And so there won't be a choice when you see Lafayette Parish Police. Either they're going to issue a summons or they're going to bring them to jail.
Right.
And if they continue bringing a second one, then the prosecutor it keeps enhancing. So between now and January, what you're doing won't be an issue anymore because it's going to be a crime. And that's the unfortunate part. It is going to be a criminal consequence with no choice. Unless
Let me ask this, Judge, let me
Yes.
ask this. Monique, if you could, or Christina, we got 2 members of CJCC. Could we committee this through CJCC, or do you think this falls outside of that and maybe a committee needs to be formed independently of?
We've actually, the governor has signed the bill. It has become an act now, Act 788, and we actually have a meeting scheduled with our 2 joint subcommittees, our jail capacity committee that has a lot of the DAs, the court, with the city court and district court judges a part of that, law enforcement, the jail is a part of that committee, our IDO attorneys are a part of that, and we have our behavioral health subcommittee. We are actually coming together on June 25th to have a joint meeting just to talk about this legislation that was passed and develop some paths forward. What we've asked the agencies to do is kind of take a good deep dive into this legislation, see how it impacts your agency, what is the funding that you anticipate may be a cost if we establish homeless court, and if we designate encampments or not. We're looking at enforcement, lots of sanitation that would need to happen. So we just sit that out. That committee is coming together. We're actually bringing both of those groups because it's not just the criminal justice side, it's all those behavioral health and the nonprofit agencies that need to get on the same page with us and develop a path forward.
So we bring in the nonprofit and the service providers in to at least
Yes, sir.
participate sub-wise to
Yes,
get
sir.
that knowledge as well?
They are part of our behavioral health subcommittee already. Yes, sir.
So that seems like the pathway forward. That I would ask that we be very intentional about that work. You mentioned District 5 and obviously St. John Street where these services are provided, I think a lot of the attention became elevated because now you have things happening outside of that footprint that has made more people see, observe, deal with, and experience what the individuals in that corridor has been experiencing on a daily basis. So it's, the encampments are taking place everywhere, right? And that has been the disruption. The unfortunate about that observation, as long as it was in one place, not many people were saying anything. And we wasn't putting forth the energy and the effort. So my ask is that we be intentional over these next few months leading up to that January implementation and hopefully have some solutions where we could kick back to Baton Rouge and see if they're going to put their money where their legislation is, and certainly look within our own selves and see what is the quality that we're trying to offer the city and parish of Lafayette.
Yes, sir, and just one follow-up. On the fiscal note that went with this legislation, it was $0. The comments in the fiscal note were all that we anticipate some potential expensive local government agencies, not sure what those will be, so they all came out as $0. It depends if they open up a court, it depends if they open an encampment, so there was literally no actual dollars attached to that fiscal note. So right now, it's truly an unfunded mandate to implement this. You don't have to do it, but they suggest that you do it, but they are making the crime of homelessness with the misdemeanors offense of $500, I think, your first time, so.
And our court is already working with the sheriff's department to route them to.
One second, Elsie, let me go to Mr. Gilbo first.
Christina, don't move. I'm fixing to pull all of my hair out of my head, and I think you know where I'm going with this. This bill is a mandate, correct? It's statewide mandate. You guys are doing a fantastic job trying to implement something with no funding. Yet and I've been screaming about this for years, they pass bills and it's zero funded. Zero. And where are you getting the funds to support these programs that I've been hearing that are very worthwhile, that are absolutely necessary to help these individuals? They have no homes to go to. They have nowhere to go. But yet, the big ivory tower in Baton Rouge, they're saying, hey, this is a good program. No doubt it is. But they don't give you a damn thing, not a penny, to implement the program. Some of you have heard me say this before. On the books today, we have unfunded mandates with the help of Karen. They ran some numbers, our CFO. We're talking about $60 to $65 million in Lafayette Parish alone that we have to cover the expenses of because of mandated programs. Here's another one that's going to be tagged on us. I can see us working and doing all that we want to do. I wouldn't hold my breath that they're going to give us a penny. I said it. That's it.
Elsie?
I just want to close by saying that if there's one thing that we do have is data, and we have a number of really exciting projects that are happening. So at whatever cadence you all think would be appropriate as we move forward, we would love the opportunity to come talk about where we are with regard to homelessness, because we can talk about that at any moment, and then also share with you all so that you have an opportunity to share that back with your constituents about what is happening, what are the programs that are involved.
What I've heard would be that appropriate place. The CJCC is chaired by the mayor president. We have parish council representation on it, city council representation, judiciary. So, because we've been too sporadic. We spread out, a lot of people doing good things in their own little isolated space. I'm hoping that this is going to maybe bring a better collaboration for a better result. Rachel?
Yeah, the only thing I want to add, I want to thank you all for your partnership. I know we've been working diligently behind the scenes for the last couple of years. Christina's kind of been leading a lot of these conversations. Just really quick, Christina, can you talk about what we are doing currently I know you have like a list of probably 6,
Yeah,
7 bullets.
real quick, guys. LCG has been working very closely with our nonprofit, our resource providers, law enforcement, ESF. Judge Garrett is at every one of our meetings and lots of other stakeholders. We're trying to identify the multiple pathways to address the concerns regarding homeless. As Elsa and Kim has said, I think there's roughly 60 emergency shelter beds, homeless population around 400, around this Acadiana, Lafayette area. And the number one issue is the lack of transitional and permanent supportive housing that continues to be the main issue addressing Lafayette's homeless. Recently, our Lafayette Transit ordered and is placing some no trespassing and no loitering signs on our bus stops to try to help law enforcement, to give them some tools to let the homeless people that are in those shelters know they're not to remain after forbidden, and that's where they can get a potential summons. So we're trying to do their due diligence. They have stepped up the enforcement of those and constantly coming out to those bus shelters. You're now seeing, because I travel where I see some every day on my route to work, they're leaving the shelters now and just staying on the sidewalk. So they're getting out the shelters, but they are still on those public sidewalks. Our nonprofit organizations have been continuing to do extensive outreach to these individuals, especially the ones at the bus stop locations, as they have been made aware of those complaints, but many are refusing any type of assistance. Catholic Charities of Acadiana recently contracted with the Block by Block program to do the downtown cleanup. That's the ambassador program group that DDA has been using, and they're taking care of litter and cleanup around a 15-block area around their shelter and diner. Arch, as Elsha mentioned, recently launched an online reporting tool. This is allowing some of the residents to reach out and request support for individuals who may be experiencing homeless, whether at bus stops, encampment sites, or any of our other locations. And as Elsa mentioned, our 12 Together coalition is comprised of a multitude of agencies that have come together. We talk via secure emails, secure, conversations, to keep those patients and, those people's privacy protected, and trying to get them assistance. And those 12 are costing us roughly about $1.2 million a year in emergency ambulance rides, police visits. They're going to jail, going to emergency rooms, all different kinds of sources. If we can get these people in some permanent supportive housing, that cost for those 12 individuals would go down to about $334,000 annually. So that's the housing issue. Mayor Boulay has also been in some good conversations with the refinery. This is a program in St. Landry Parish to try to see about expanding their program here into Lafayette to open additional homeless transitional and emergency housing. This is a program that requires the homeless to become sober and work on life skills and become active members of the community. I toured that myself. It's an incredible program that he is running. It's about 120 homeless individuals. It is an all-male facility, and he is very interested in bringing that type of a housing unit where he's having them work in the facility. They're cooking, they're cleaning, they're running their logistics, transporting people back and forth to work, and they do drug testing every day. It runs a very top niche shop. It's just another tool in the toolbox. It's not the answer to everything. It's just another tool, another resource. And since Mayor President Boulay's administration has come in, our community development department has issued over $2 million in grant funding to our nonprofit and resource providers for housing programs and homeless services. And lastly, as you guys know, I have mentioned it before, we have been working on a crisis center here in Lafayette, and we're coming down to the final wire. I think we're going to get to that point. We're working with Brad Form at his location at the Taylor Center around Dulles Street, and we have set aside $1.9 million in opioid funding to kind of get that program off the ground, and this will provide behavioral health resource for those who are in acute level of need, whether it's substance abuse or mental health, to try to get that treatment and then get them moved out of that facility into a longer-term care. And it looks like we're going to get that hopefully off the ground somewhere around January of next year. So that's kind of what we've been doing.
A request is to, I haven't seen Jamie in a while, but if you could get with Joseph, get with Jamie, and if you
Jamie's on maternity leave for a little while.
Oh, well, don't get with Jamie. Leave Jamie alone. Okay, well,
So
that's a
it's
good
me.
reason
You
not to
stuck
say-
with me.
Okay. Well, whoever is that next, that information needs to get out. The biggest issue that we face at the council office, but even out in the community, I would think, for most council members, is that a lot of people don't realize what's being done. Therefore, they are frustrated. What you just said, with all of what is happening, if we could get that into some form of informational release, hopefully the media would take advantage of that, and whatever campaign could be had to make people understand that people, the people are seen on the sidewalks. They're seen in the wooded areas near residential communities. They're seen on the sidewalks on St. John in Holy Family Catholic Church. No one is blind to that, but we need to show them that the thought and the effort that is being put into something to keep that hope going. If y'all could work on that, I would appreciate that.
You got it.
Ms. Hebert?
Thank you, and thank you all for your information and all the work that you do. Christina, quick question for you, or maybe this administration, is while we're working and having these meetings and the collaboration between everyone that needs to be involved, that's great, but I think that two things can happen at the same time, right? Is working on how, the calls I get the most are homeless sleeping, or unhoused, sleeping in the bus stops. And I have calls from supermarkets, grocery stores, restaurants, of their employees scared to go out, to go wait for the bus that they actually utilize. And people who want to bring their kids to the park or go play at the tennis courts don't want to go because there's homeless people, or, unhoused people loitering and utilizing those resources that they also want to utilize and they feel unsafe. Is there a number that residents should call if they see someone sleeping, whether it's Catholic Charities, art, police department? I'm open to, that way the public is here, assuming everyone's here for this topic, is what,
If we can let Arch take it.
sure.
Yeah, we have a portal. And so
Okay.
it's on the Arch website, as well as our partner agencies all have a button. It all goes, so it's a very short form. People can do it anonymously or identify who they are. It can be somebody they drive by every day, or it can be, like you said, they're uncomfortable at the park and they want to report that, okay? And it can be as descriptive or not descriptive as possible. It then dumps onto a map that all of our outreach workers utilize so that we can respond. So it really needs to be sort of a community science approach, right? As much information as we can get about where people are staying, it not only will help it will help those who are troubled by seeing people who are unhoused, as well as the people who are unhoused, right? We can help people once we know that they're there. So archacadiana.org, there's a button right at the top, or any of our websites.
How soon does your team embark on going to assist that person?
If it's an acute case, which is, you can, there's an open notification center, so if you're like, I'm really concerned this person looks like they're in a crisis, that's one thing. But we push that information out to our outreach workers on a daily basis. So it may not be that same day, it may be the next day. We're just not, an emergency services response service.
And I respect
you
that, and I love
also-
that you have that, but if I'm someone who works at a supermarket and I need to go get in that bus stop, single woman, I'm not going to stand over there. That's unsafe. It is. You cannot have people put in that situation. Or I'm a mom.
Councilwoman, what we have told them is those two things, contact Arch, for
Sure.
we say the non-emergency situations. If you have an emergency situation, a public safety type issue, you call 911 and PD will come out
Okay.
as soon as they can. Chief Gerard has sent people out there. It's conversations they try to have first. We try to also notify the resource providers so that they come at the same time potentially. And that's how we're trying to address these.
All right, wonderful. I'd like
The
that
main
information
people-
included in
Yes, ma'am.
your press releases, so that way people know what to do and what numbers to call or what website to go to.
The main people at the bus stops are people that use spice, and they're high, and they're psychosis. That's where my drug court people go. That's where I go find them and
Yep.
say, police, they are using spice. What spice does is put you in a psychosis. And so you might think it's mental health, but it's not. It's the use of a synthetic drug that alters the brain, and they become something else. So if they are notifying the police of that, police know what to do, and they will contact us.
Wonderful.
And most of them, if they're hanging out there and they've gone out of the drug court team, then chances are we were looking for them anyway. So if they come across the people at the bus stop with that kind of behavior, they definitely need to call 911.
Wonderful. Thank you,
And
Judge.
then they will reach out to me.
Thank you.
Councilman Nakam?
Again, thank y'all for being here tonight to discuss this important topic. I've read through this bill like 3 times now, and in the very beginning, it talks about their goals. And number 8 on the goal out of 9 is to provide housing assistance for those experiencing homelessness in partnership with state, local, and federal housing authorities and nonprofits. Well, that's everybody here. But how far short have they come on that goal, you know? I'm wondering if we, as an elected body, both parish and city, shouldn't put forth a resolution demanding they come up with some answers for the funding of this, because this is totally ridiculous to throw this out there, which is, it's the beginning of a good solution, but with no way to pay for it. You know, and we knew as a municipality we can't afford it. You know, there's no way we have enough expenses to worry about within our own system here. And this goes all the way back to the federal government. The onus put on the state to go back to the federal government. So maybe we should put forth a resolution to go to our federal and state representatives to let them know that we expect to see some funding from this, that we would be glad to enforce it and bring it forward, but we need your help because we can't do this on ourselves, on our alone. So I think you should probably consider something like that.
We could certainly entertain that. Is Latweeta Smarts on your team, Christina? Latweeta's on that team?
Yes, sir.
With the Housing Authority? Okay, good. Councilman Gilbo?
Mr. Notkamp, I certainly think the resolution or whatever we decide to send, it's commendable. I don't think it'll, number one, they should, when they introduce a bill and if there's a funding mandate, a fiscal note, it ought to be attached from the get-go. Right. These people are trying to fund a state mandate using their current funds, which means they're taking funds away from some other program. And we're talking about excellence in trying to service these young people or older people, and it's not going to happen. You're asking us to help these people using our hands tied behind our backs. And if you don't, then you're going to be cited for not following a mandate that they impose on us without funding. Sorry.
Thank you. So I think we got the gist of what is needed. And I think there's an assignment that has been asked of. And again, I ask that we be very intentional about it and let's not have any stopgaps between now and January. Maybe come back with a goal of some type of updates in 90 days or so, as I know y'all about to assemble a group, but please keep us informed, and we truly appreciate the information that has been given here tonight, and that informational piece that we talked about, that would be huge, I think, in this effort. So.
Yeah, hello, Council. My name is Brad Farmer. I'm the Executive Director for Acadiana Area Human Services District. We are the public entity that provides behavioral health and developmental disability services in our 7-parish area. So I know we're talking about Lafayette, but I'm looking at it from the lens of 7 parishes for treatment for these persons we are talking about. And I'm glad that Kim was on record saying she asked me here because I was just supposed to be here to answer questions, so let me jump in. This bill raises a lot of other questions that haven't even been addressed yet. From a provider standpoint, when this says people are mandated to treatment, that turns that counseling relationship into something we do to them rather than we do with them. And treatment and recovery is primarily, it is much better outcomes for everybody involved when those persons want to attend on their own, and it's something we can do with them. Another thing that's not defined in there is levels of care, what those services are, licensure standards. This is what's rolling through my head when I see we have to take a certain population. We want to do everything we can, to your point, sir, to serve the communities that we're in, but we're limited by that also. Every one of our parishes is identified through federal standards as a behavioral health workforce shortage area. And so now we're going to take a population that may or may not have necessarily a diagnosable condition. Homelessness is a situation, sure. And some of those folks may abuse substances, they may have some mental health issues, but they're not synonymous. And so to say if you're arrested for homelessness, you must go to treatment. Well, if you're sending these folks to licensed providers, there are certain clinical standards that have to be met. Then you have to have licensed clinicians willing to sign off on that. The judge mentioned something about we try and enroll folks in Medicaid as soon as possible. Now you're having to meet medical necessity criteria. Now you're having to deal with managed care, and on and on and on. And so in addition to this being unfunded, there's just a slew of issues and concerns with the way this is written now. And so I just bring that to you from that provider perspective of the actual, what are we trying to do? Homelessness is certainly a major issue. I'm not trying to take away from that at all, as is the criminal justice issue. But the behavioral health component of that as well is its own freestanding profession that has its own rules and guidelines and how we can interact with the population we serve. So
Yeah.
just want to put that in.
No, that's necessary. Again, we can't, simplify a very complicated issue.
Right.
That'll be the biggest mistake we could make.
That's exactly right. If the only thing in your toolbox is a hammer, everything is a nail.
Yeah.
And that's not the way this
That's
system
not,
works.
no, can't be.
Yes, sir.
So again, I thank you all, and looking forward to some reporting on progress soon.
Thank y'all so much for raising this as a discussion item today, and I know that we're all here tonight, everyone in this room, because we want Lafayette to be a better place for everyone. And so thank y'all for the time that you spend towards making sure that the least in our community get the care that they deserve. So thank you.
Absolutely, thank you. Any public comment on this item, Joseph?
No, sir.